Alright, so we're just going to perform task 5, which is just performing a culture to identify dermatophytes, aka ringworm. I have my friend Sky here and my assistant who's going to be restraining her. She's really been licking and chewing at her right front leg a little bit, so this area seems a little irritated, has a little lesion there, so we're just going to go ahead and culture that for ringworm just to see if maybe she has ringworm. So I have all my supplies right here. I have some alcohol gauze to prep the area. I have some dry gauze just to dry it up. I have my sterile hemostats to pluck the hair and skin scales to get my sample. I have my DTM plate right here that I'm going to be putting my samples onto to test for the ringworm. And then I just have the patient label that I'll be putting on the lid afterwards that just has Sky's name, her date of birth. It's going to be for Dr. Duffy. The test is culture for ringworm. And then we'll take it from there. So I'm just going to have my assistant hold on to our friend Sky, and I'm just going to be taking her right front leg. And the first thing I want to do is prep the area because we're trying to keep it as clean as possible and not have any contamination. So I'm going to take my alcohol gauze and we're just going to prep the area a little bit. Good girl, sweetie. And then I'm going to take my dry gauze just to make sure it gets dried up. And her hair here is long enough that it's at least 0.3 centimeters long or more. So that'll give us an adequate sample for our agar plate. So I'm just drying it up. Good girl, sweetie. Okay, so now I'm just going to open up my hemostats. And we're just going to try to get at least 3 good tufts of hair to put onto our plate, which I'm going to remove the lid. And then this way I can place it directly onto the plate. All right, you ready?
All right.
Okay, so I got 1 tuft. Good girl. And I just want to gently take my hemostats and place it down onto the plate. Okay, Mama. 1, 2, 3. Oh, such a good girl. Okay, we're going to place that onto the plate. We're just going to gently press it down onto the agar in the dish. Good girl. All right, Mama, 1 more. We'll go to this area right here. 1, 2, 3. Oh, such a good girl. And as you see, before I put this on the plate, just a nice, it's at least 0.3 centimeters or more. Nice tuft of hair. So that's going to be our 3rd tuft. So we're just going to place that and again, gently take our hemostats and press down on the agar just a little bit. Just so that is on our plate. Okay. And then I just want to check her leg just to make sure we look okay. Good job, sweetie. You're a good girl. Okay. So now you can see on my DTM plate, we have the 3 tufts of hair that are gently pressed onto the agar in the plate. Okay. So we're just going to come back over here. We're going to keep our lid on top of the agar plate just nice and loose, so it easily comes on and off, as you can see. And we just want to put the patient label on top of it so that we know whose sample it's for. Okay. And as per the manufacturer, we are to store this at room temperature or incubate it at room temperature. And I'm going to put it up in our cabinet with her label just so it's in a darker area so that if there's going to be any growth or any color change, we'll start to see those within 24 hours or longer. But for now, I'm just going to put it into the cabinet at room temperature, and we're going to reevaluate it in 24 hours and check it daily from there on out just to see if there's any growth of any sort or any color change. So again, that is the first part of task 5, just doing a culture for ringworm.